Hi, my name is Mike Horsey, PGY4 from Walter Reed. Did my research here at GW. Today I'm happy to present our work on looking at disparities and utilization of the robotic platform for colon cancer. I have nothing to disclose, and this is just the standard DoD, that my views don't reflect the views of the US government or the Department of Defense. So I think we all know here that minimally invasive surgery has proven significantly better for patients compared with open surgery for the management of colon cancer. That's been proven in multiple randomized trials. However, despite the more widespread use of laparoscopy to address colon cancer, especially in the past couple decades, several disparities persist with patients with regards to race, income, and insurance status for patients who are offered laparoscopy. Though robotic surgery hasn't been shown to have significant advantages over laparoscopy for colon cancer yet, the use of the robotic platform has significantly increased over the past decade and is even eclipsing laparoscopy in some centers. So the study objective was to elucidate associations between demographic, clinical, and socioeconomic factors with receipt of robotic surgery. This is a retrospective review of the National Cancer Database from 2010 to 2016, which encompasses about 70% of new cancer diagnoses in the US. We looked at patients with non-metastatic disease. Our exclusion criteria are there. And we were looking at demographic, clinical, and facility-related factors with preferential use of robotic surgery. So patients who underwent robotic surgery, there are about 3,000 that we found in the past, in that 6-year period. Patients who received robotic surgery tended to be younger, more likely to be white and not black. Patients who were from metropolitan areas as opposed to urban or rural areas. Patients who had private insurance compared to other types of government insurance. Patients who lived in higher educated areas with higher incomes, fewer comorbidities, and less clinical or lower clinical stage, and tended to be diagnosed in later years and receive a more limited colon resection. Patients also tended to receive robotic surgery if they were at academic or research hospitals or integrated cancer networks compared to their community counterparts, as well as high volume centers compared to lower volume. And this is just a multivariable logistic regression, basically showing the exact same thing as I mentioned earlier. So if you were older, you had slightly decreased risk or slightly lower odds of being offered robotic surgery. If you were black, received care in an urban hospital, had any other type of insurance aside from private insurance, if you were less educated, less likely to get robotic surgery, and then lower or higher clinical stage was less likely, more recent years of diagnosis, more likely to get robotic surgery, as well as limited colon resection, more likely to get robotic surgery. And then just showing if you were in a community center, you had lower odds of getting robotic surgery, and then moderate or higher volume facilities were more likely to offer robotic surgery. So in conclusion, younger, white, privately insured patients living in metropolitan areas with higher income and education status were more likely to be offered robotic surgery versus the open or laparoscopic approaches. Patients with less advanced clinical disease requiring more limited colon resections and those who receive care at high volume academic centers were also more likely to get robotic surgery. We saw in our study, as expected, that there was a significant increase in the use of the robotic platform over the course of the study. Limitations, as this was a retrospective study, included selection bias, lack of patient preference for surgical approach, and lack of surgeon-specific information such as time in fellowship or time in practice. And just a personal viewpoint, in order to provide equitable care, facilities and surgical providers should be focused on actively reducing these disparities and access and utilization of robotic technology so we can provide this to all patients regardless of their backgrounds. That's it, and I'd be happy to take any questions.